In this video, I'll be talking about lithium. I want you to know the indications for lithium, the side effect, and the toxic side effect. So, lithium is a mood stabilizer. It's actually the gold standard for the treatment of bipolar disorder, precisely mania. It is also a neuroprotective agent. It has some anti-suicidal properties. So, for board purpose, you want to remember this statement. It's the gold standard for the treatment of bipolar disorder. It is a neuroprotective agent. It has a very active anti-suicidal properties. So let's go further. What are the required labs that we need to check before you start any patient on lithium? So before you start anyone on lithium, we need to do the kidney function test. Basically, you want to check their creatinine, the BUN. We all know that lithium is excreted by the kidney. So it's actually better for us to check the kidney functionality before we start to give patient lithium, because the lithium will be excreted by the kidney, and if the kidney is faulty, the lithium is not going to be excreted by the kidney, and that will lead to more of the toxicity. We don't want that to happen. So very important to check the kidney function. It is also better to check the pregnancy status of the female patient that will be taking lithium. Lithium is known to cause a birth effect called Epstein anomaly. That's the major birth defect that lithium causes. That's that cardiac problem that we see in babies, in the newborn babies. So when a patient is to take lithium, we want to rule out pregnancy. So ensure that the female patient is not pregnant before you place them on lithium. Next, we want to check the EKG of the patient. Lithium basically causes T-wave inversion. So once it causes T-wave inversion, you want to check the baseline EKG of the patient. If the patient already has a cardiac problem, especially in the aspect of T-wave inversion, you don't want to start the patient on lithium. It is also important to check the thyroid function test. You want to check the thyroid stimulating hormone. We want to check the T3 and T4 because basically lithium causes hypothyroidism. It causes hypothyroidism, so better to check a baseline TSH, the T3 and T4. We also want to rule out hyperthyroidism. It is important to know that hyperthyroidism, all the signs and symptoms that we see in it, looks like psychomotor agitation. Everything is on the high side, and that may mix symptoms of mania. So you want to be careful so you don't place the patient on lithium while the patient is having symptoms of what? Hyperthyroidism. Don't forget that mania and hyperthyroidism almost have the same signs and symptoms in the aspect of what? Increased psychomotor agitation. So don't confuse hyperthyroidism by thinking that the patient has what? A bipolar disorder. And that's why you want to check the baseline TSH, the T3 and T4 to be precise whether the patient has what? A hypothyroidism or hyperthyroidism, and you can rule that out, and you don't have a mistake of thinking that the patient has what? A bipolar disorder. So basically, lithium also can cause leukocytosis. It can also cause diabetes insipidus. That is the situation where the patient has to be urinating every now and then. So when they urinate every now and then, they'll get dehydrated. And when they are dehydrated, there's going to be more buildup of lithium in the system, and that will lead to lithium toxicity. So very important, the reason why this patient has to be given more of hydration just to prevent what? The diabetes insipidus that the patient is presenting with. It's also important for us to know the normal blood level of lithium. When a patient is on lithium, the therapeutic blood level is 0.6 to 1.2. That is the basis that we are expecting from the patient. So at what point does lithium get toxic? So and that leads us to talk about lithium toxicity as well as the side effect. The normal blood level should be 0.6 to 1.2. But the moment the lithium level is 1.5, we will start talking about lithium toxicity. So we can use lithium itself, the word LiThiums, to explain the side effects or the symptoms of those lithium toxicity as a mnemonics. The L will be loss of appetite, the I will be increased urination, the T will be thirst and tremor. The patient is going to have increased thirst because they are going to be a little bit dehydrated, and you also see them having a coerced tremor. The H will be hypothyroidism, and you will see them losing some of their hair loss. The I is problem with vision, issues with vision. The U is upset of their stomach in the aspect of gastrointestinal disturbances, precisely diarrhea. The M is muscle weakness, and the S is skin or thickening or in form of rashes. What electrolyte imbalance does lithium toxicity cause? So it is important to know that when a patient is on lithium and they are taking it more than expected, or it is more than the normal therapeutic level, it can lead to hypercalcemia, a high level of calcium. And this is coming as a result of what? Hyperparathyroidism. When the patient is taking a lot of lithium, there's possibility of having hyperparathyroidism. And we know that in hyperparathyroidism, there will be excessive production of parathormone or parathyroid hormone. So when there's high level of parathyroid hormone, basically you will see the patient also having what? A high level of what? Elevated what? Calcium level. So in hyperparathyroidism, there's going to be high calcium in that individual. So it was also proposed that lithium, basically, it interferes with what? Potassium imbalance. And how does that comes by? So basically it's going to cause an intracellular hypokalemia and extracellular hyperkalemia. So depending on the clinical context the patient is presenting with, some of them present with what? A high potassium, and some present with what? A low potassium. And that is why you will see this electrolyte imbalance, precisely this potassium imbalance. There will be interference with depolarization, and that will be manifested in form of all this ST inversion, T wave inversion, and there's going to be some changes in their EKG. What are the causes of lithium toxicity? Basically, if a patient takes a lot of lithium, that is excessive intake. If the patient is extremely dehydrated, and you will see lithium built up in the body. And basically, if the patient has a situation where the lithium cannot be excreted from the body, and basically that is what? A renal impairment. So basically those three is going to lead to what? Lithium toxicity, precisely. So what do we have to watch out for in lithium toxicity? Generally, before we start a patient on lithium, we want to check the lithium level 5 to 7 days after the patient is started on lithium. The moment this patient has been placed on lithium, within 5 to 7 days of starting the initial dose, you want to check the blood level of lithium. Also, every 2 or 3 months for the next 6 months while the patient is on lithium. And also, you want to also check it every 6 to 12 months while the patient is on lithium. That is if the patient is stable. But if the patient is unstable, you still want to check it every 3 months. And don't forget the fact that you also want to check the lithium level 12 hours after the last dose of taking lithium. So what drugs can cause lithium toxicity? Basically, the ACE inhibitors, those medication ending with PRIL, we call them the Pril sisters, the lisinopril, enalapril, the ACE inhibitors, the NSAID. The most popular NSAID is the aspirin. We have the ibuprofen, we have the ketorolac, we have the meflac, the diuretics, especially the thiazide. So these three medications, when a patient takes any of these three, and this same patient is taking lithium, what this medication does is that they reduce the renal clearance of lithium. If it reduces the renal clearance of lithium, so that shows that there's going to be more build-up of lithium in the system, and patient will have more of the lithium toxicity. So note that this is just a tidbit or an highlight to what you need to know, basically to pass the board exam, the PMHNP exam. For you to have more content, a more detailed content review, kindly visit our website at www.advancedmpcertificationreviews, or you can call my number 281-372-9148, or you can send me a direct message to the same number 281-372-9148. Thank you and God bless.